Hello. Welcome to Congressman Brindisi's second coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator. Thank you for joining us for another informative discussion with questions and answers about COVID-19. In addition to hearing from the Congressman this afternoon, we've got a few healthcare professionals and representatives from the U.S. Small Business Administration and 211 of the United Way on the line to answer your questions. We're going to be starting the call shortly, but we'll let folks continue to dial in for a few more minutes. In order to ask a question, all you have to do is dial *3, and that will put you in queue. Just *3 to ask a question. For folks just joining us, welcome to Congressman Brindisi's second coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this afternoon. In addition to hearing from the Congressman this afternoon, we've got a few healthcare professionals and representatives from the U.S. Small Business Administration and 211 of the United Way on the line to answer your questions. So to ask your questions, all you have to do is press *3. That's *3 to ask a question. We do anticipate we'll be receiving a lot of questions this afternoon, and we're going to do our best to get through as many of them as possible. But if you don't get to ask your question, please hold on the line at the end to leave a message so we can get back to you. We'll get started in just a bit. Just want to remind everyone that the way to ask a question is to press *3. That's *3 to ask a question. Welcome to everyone just joining us, the Congressman Brindisi's second coronavirus Tele-Town Hall. Just want to remind you that in order to ask a question, all you have to do is press *3. That's *3 to ask a question. In addition to hearing from the Congressman, we've got a few healthcare professionals and representatives from the U.S. Small Business Administration and 211 of the United Way on the line to answer your questions. To ask the question, all you have to do is press *3. That's *3 to ask a question. We'll just give everybody a few more minutes to dial in and join us. All right. Just a reminder, it's *3 to ask a question, but I'm going to open the floor up to the Congressman. Anthony, would you like to give us a few remarks?
Yes, thank you so much, Sarah, for hosting this today, and I want to thank everyone for joining the call and taking time out of your afternoons. I know, like many of you, I certainly understand how scary this is and how desperate you are for answers, and that's why we're holding this event this afternoon. We want to answer your questions, provide the information you need to protect yourself and your family, and give you confidence that officials are doing everything we can to keep our community safe. This afternoon, you're going to hear from experts from SUNY Upstate Medical, as well as the U.S. Small Business Administration, Rural Health Network of South Central New York, and the United Way. Now is the time for diligence, and while health officials do their jobs, we all have a duty to do our part. Even those who are young and healthy need to consider the elderly and people with underlying health conditions. We are a community and rely on everyone to do their part, so it's important to follow a few basic health guidelines during this pandemic. First, it's always important to clean your hands often. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your eyes, nose, and mouth with unwashed hands. It's also important to avoid close contact and stay home if you're sick. Avoid close contact with people who are sick, and put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at higher risk of getting very sick. Make sure to cover coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Throw used tissues in the trash, and immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not readily available, clean your hands with a hand sanitizer that contains at least 60% alcohol. Also, wear a face mask if you're sick. If you're not sick, you do not need to wear a face mask unless you are caring for someone who is sick and they are not able to wear a face mask. If you are sick, you should wear a face mask when you're around other people and before you enter a healthcare provider's office. Clean and disinfect. Clean and disinfect frequently. Touch surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. I want to give you just a brief update of some of the legislation that has been passed and signed into law in response to the coronavirus pandemic. A couple weeks ago, Congress passed and the President signed into law the first Coronavirus Response Act, which included $8.3 billion to help fight the pandemic. This money was allocated towards federal agencies like the Centers for Disease Control and the U.S. Department of Health and Human Services and other federal agencies and state agencies that are on the front lines fighting the pandemic. Last week, the President signed the Family's First Coronavirus Response Act, sometimes known as the Second Coronavirus Bill. This legislation included free testing for anyone who needed to be tested, as well as emergency paid leave and paid family leave for people who are sick, caring for someone who is sick, or has to be out of work to care for a child. In addition, this legislation included funding for local governments and the state of New York. It included money for counties who are on the front line fighting the pandemic. So the counties in the 22nd Congressional District, which we are in, received an additional $30 million to help fight the pandemic. Yesterday, the Senate passed the third Coronavirus Stimulus Act, which is now being brought up in the House of Representatives tomorrow. This legislation does a number of things. It's a $2 trillion package which helps fight coronavirus. There is a $200 billion investment in hospitals and health systems, as well as health research, $150 billion for state and local governments in this agreement to give them the resources they desperately need during this emergency. For our workers, there is a $260 billion investment in unemployment insurance benefits to match the average paycheck of laid off or furloughed workers. And there's an additional 13 weeks of federally funded benefits to be made available immediately. In addition, there are direct cash payments. You may have seen this in the news as well. There are $1,200 payments for individuals earning below $75,000 and $2,400 payments for couples married filing jointly, in addition to $500 cash payments for each child. In addition to that, for our small businesses, there is $377 billion that is going to be infused for fast relief for small businesses to help them cover expenses while they may be closed down. In addition, there is $30 billion in emergency education funding and elimination of the income tax on student loan repayment assistance by an employer. There's also accountability and oversight for larger industries to prevent secret bailouts and more oversight, so things like CEO bonuses and stock buybacks did not happen as a result of getting government funding. As I said, that bill passed yesterday in the Senate. It's scheduled to be passed tomorrow in the House of Representatives, and the President has said he will sign it into law immediately. That is a summary of what we've been working on in Congress right now. I know that our office, although our physical locations are closed, our full staff is teleworking from home and responding to emails and phone calls. We have received a number of phone calls over the last couple of weeks from constituents. So if you have not received a call back yet and you have left a message, please be patient. We will get back to you. We are working to get through the volume of phone calls that have been coming in. But I want you to know that we are working very hard. The coronavirus knows no political party. It is something we all have to work together to address. And as always, I'm here to serve you as well as my office. So I will be listening to you and taking your questions and also listening to your feedback. Thank you very much. And Sarah, I'll turn it back to you.
Thanks so much. Just want to remind everybody before I start introducing our panelists that in order to ask a question, you have to press *3. That's *3 to ask a question. Our first panelist I'm going to introduce is Jack Salo, the Executive Director of the Rural Health Network of South Central New York. Mr. Salo, would you like to give us a few remarks?
Thank you, Sarah. Thank you, Congressman Brindisi. I was invited to today's town hall to provide information on resources to help with basic needs and services that are occurring because of the COVID-19 pandemic. With restrictions on travel and orders to stay at home, many residents, especially older residents, have questions and concerns about how to get the food, prescription medication, and other essential goods and services they need. If you or someone in your household is 60 years of age or older, you can contact your county office for aging. Yesterday, we called the offices for aging in Shenango, Cortland, Madison, and Oswego counties, and they are all taking calls and providing services during their regular business hours. The county offices for aging are expert on services and issues that impact older residents. They are available by phone to help you during this time. In a few minutes, Mary Shaheen, president of New York State 211, will be talking about how the 211 programs available in each county can help you with questions about essential services you may need, including transportation, food, and housing-related issues. As is always the case with our rural communities, family, friends, and neighbors are supporting those who need help. This is as it should be, but we know there are others who are not fortunate enough to have a strong support system and need our help. This is where our community and civic organizations, the faith community, governmental services, including offices for aging, as well as state and federal assistance come in. I am particularly concerned about those older, isolated people who may be frightened and without support. Please reach out to anyone who you may think needs a phone call and to hear a friendly voice. In conclusion, I want to remind everyone that in our rural counties, many of the volunteers that serve our communities are older and more vulnerable to COVID-19. They should not be exposing themselves to the virus. Programs like Meals on Wheels, volunteer transportation, and food pantries are struggling to meet critical needs and are without their full volunteer workforce. I ask that those of you who can volunteer and are not in a high-risk group consider doing so during this challenging time. Contacting your local United Way is a good source of information on volunteer opportunities. Thank you for your time, and stay safe.
Thank you so much. Just a reminder to everybody, in order to ask a question, you have to press *3. That's *3 to ask a question. Our next panelist is Dr. Timothy Endy, who is a professor of medicine and chair of microbiology and immunology, and also a specialist in infectious diseases at SUNY Upstate Medical University. Dr. Endy, would you like to give a few remarks?
Yeah, thank you for inviting me to participate. My compliments to Congressman Brindisi for putting this on. Half the battle that we're dealing with is getting accurate information. And certainly town halls like this will spread the right information so that you can combat this problem at home and in the community. My background is in infectious disease. I'm a clinician, also clinician researcher, the chair for microbiology and immunology. My specialty is in emerging viruses and vaccine development, so that whatever information that I have, I'm happy to share and answer any questions that we have. I can tell you as a representative from Upstate Medical University that the colleagues here and the leadership have been outstanding in preparing for this outbreak, and they stand ready to meet any challenge in the community and to provide all the support that's needed. And thank you.
Thank you so much. Just a reminder to everyone, in order to ask a question, you just have to press *3. That's *3 to ask a question. Our next panelist is Bernard J. Paprocki, District Director, Small Business Administration. Mr. Paprocki, would you like to give a few remarks?
Sure. Thank you, Sarah, and thank you, Congressman Brindisi, for inviting me here today. Like all of you, we are also working from home for the first time in my long career, getting used to working remotely. But we are also responding to an unprecedented volume of calls and requests for help from small businesses throughout 34-county region, which I cover in upstate New York, and nationwide as well. Currently, the SBA has made available what they call economic injury disaster loans. These are loans that are good for up to $2 million. First $25,000 of that loan requires no collateral. We are currently offering a 12-month deferment on the first payment of that loan. And these loans can be used to pay fixed debts, payroll, accounts payable, and other bills that cannot be paid because of the disaster's impact. I would suggest that anyone that's interested in further information about this or any of our other programs to call our office at 315-471-9393 or visit us online at sba.gov. You'll also get information there that will point you directly to the application process for our disaster loans. I just ask that you be patient. There are a large volume of inquiries and phone calls, as you can imagine, and of course, the interest in what we can do and help provide there's more to be coming next week after we find out the details of the bill that's being passed that the Congressman referred to earlier that could be passed tomorrow. With that, I will turn it back to you folks for questions. Thank you.
Thank you so much. And our final panelist, Mary Shaheen, President of 211 for the United Way. Mary, do you have some opening remarks?
I do. Thank you. Thank you, Sarah, and thank you, Congressman Brindisi, for hosting the call today. And thank you to everyone who preceded me on this call for the invaluable information you have to share. All I can say is through this pandemic, information is our friend, and accurate information is life-saving. Many people, and probably a lot of people on the call today, have never heard of 211. And information is 211 stock and trade. You've heard phone numbers today. You've heard phone numbers over the last couple of weeks of if you have a question about this, call here. If you have a question about that, call here. How do you track it all? How do you remember it all? Well, I'll give you one phone number that's very easy for you to remember, and that is 211. If you dial 211 any day of the week, any hour of the day or night, you will be connected with a call specialist who has at their fingertips an array, a huge database of health and human services resources. And if there are services available to assist you with what you need, they can point you in the direction of that service. So 211 is a phone number. It is also a service, a source of information and referral. It is available to everyone. There are absolutely no eligibility criteria to use 211. There may be eligibility criteria for some of the services that you are seeking And sometimes we find that the services don't exist, but it's at least a starting point for you to answer the question. And if the website is more to your search liking, I would encourage you to go to 211nys.org, click on Find Services, and then you can do a search by county. And I'll just give you a short idea of the kinds of things that we can provide information and referral on. Anything from housing to food and mental health to disaster resources, legal, employment, education, transportation, finances, substance abuse, and health. Like everyone else, since the virus really took hold in New York State, our contact centers have been inundated with calls. But we remain fully staffed 24/7, 365, and it may take more than 20 seconds to get somebody to answer your call, but your call will be answered. Thank you.
Thank you so much. All right. Just a quick reminder before we take our first question, in order to ask a question, you just have to press *3, that's *3 to ask a question. Oh, look at that. We've got a question from Judith. Judith?
Yes.
Can you hear us? All right. Do you have a question?
Yes. I'm 72, and I need to go to the laundromat. I haven't been there in 2 weeks, and I just wonder what the safest way to do this is. Someone told me to take a squirt bottle with soap and water and wear gloves, but I don't know if that's the right thing to do, but I just need to go.
Dr. Andy? I'm thinking this might be your
Yes, that
specialty.
sounds like a question that I can help you with. Thank you for the question. So the current recommendations is to social distance, as Congressman Brindisi mentioned, as well as to make sure that you take personal protective measures that involves hand washing, disinfecting your surrounding environment, wearing a mask if you're sick. So, I think going to the grocery store, needing to go to public facilities, and in your particular case, going to laundromat, I think the best advice would be to go during off hours when it's not utilized by a large number of people, if that's possible. To go there and to see and make sure that there's proper social distancing among people that are present there, that you keep a distance as well. To make sure that you wash your hands very thoroughly after touching any of the equipment. And then I think with those safety precautions, you should be fine to be able to do that.
All right, great. Thank you so much. Let's get to another question. We've got George from Oneida County. George, can you hear us?
Yes, I can.
All right, you've got a question?
Yeah, I wanted to ask the congressman or anyone on the panel. I've heard that they're going to start bringing patients from New York City into our local hospitals here. I live in Rome, and we only have one hospital. If that's the case, what are we going to do? I'm 74, and I have diabetes, so I'm a little concerned about everything that's coming down. What happens if I need a bed or someone I love needs a bed? How are we, is this a play just to put more people in the bed to get more income, or is it, I don't know, it's just a confusing situation.
Well, I can talk a little bit about that, and I'm not sure, maybe Doctor, you can mention what you've heard from the hospital perspective, but what I have heard the governor say is this is really a statewide response right now, and New York is the epicenter of the coronavirus pandemic, unfortunately. Most of that right now is concentrated in the downstate region, so New York City, Long Island, the lower Hudson Valley area is the area that's being most impacted, although we are seeing an increase in the number of cases across the counties in upstate New York as well. There are simply not enough hospital beds across the state to be able to deal with the current pandemic, and that is why the president has signed a major disaster declaration for New York, which has opened us up to all kinds of assistance. One important piece of assistance is the Army Corps of Engineers, who has been in New York and is now looking at areas around the state that they can use or retrofit to help accommodate overflow at hospitals. So as beds in New York City begin to fill up, the state is going to look to other parts of the state where they can accommodate that. But again, we need to have additional space in addition to what the hospitals have, and that's where the Army Corps of Engineers right now is looking at where they can utilize that space. For example, in New York City, they have the Jacob Javits Convention Center, which is now being converted into a medical facility to help accommodate overflow of patients in New York City. I have sent a letter to the Defense Secretary, along with Congresswoman Stefanik from the North Country, asking them to look around the upstate area and also consider perhaps old hospitals or spaces around upstate New York that can be used to accommodate overflow, so our hospital beds are freed up for patients within our counties, and we can be able to accommodate people for everything. But it's clear we need more beds right now, and hospitals are doing their inventories and trying to accommodate that in their own health systems. But it's important for us to try and flatten the curve as much as we can, so we can hopefully not need as much hospital space. But in the event we don't, we're going to need more hospital space, and that's why I think the Department of Health is looking all over the state right now.
Yeah, this is Tim Endy. If I can add to the Congressman's comments, George, I appreciate your concern. I have a 82-year-old father who lives in Floyd, right outside of Rome, and I share your concerns about meeting his medical needs in this time of crisis. And there are only, as the Congressman said, there are X amount of beds, and this pandemic is unprecedented. But I can reassure you that in central New York and upstate, there is a huge degree of coordination going on in increasing the bed capacity in our area. And as of this week, there is plenty of capacity to meet everyone's health needs. I haven't heard from our CEO any definitive plans about transportation of patients from New York City, but we as healthcare professionals will go wherever we're needed and to provide the support to our fellow New Yorkers as well. But there's a lot of efforts at upstate and other hospitals to convert to a telemedicine approach so that they can coordinate with your care at home as much as possible to help prevent you from needing a hospitalization. So I think there's a lot of efforts to that, and I want to reassure you that whatever happens to you and your family, that your needs are going to be met.
Thank you both. All right, let's take another question. We've got Steve from Vestal.
Yep. Hello.
Steve, hi. You've got a question?
Hi, yes, good afternoon. My question's regarding the bill that just got passed. I am self-employed. I have, since this started 2 weeks ago, I got zero income, and I see that in this bill that they are going to allow people that are self-employed to collect unemployment. My question is that going to be done through the state or the federal government? I have tried to contact several people in the Department of Labor in New York, and with what they're going through, you cannot get a hold of anybody. Their website keeps going down, and as far as getting a hold of anybody on the phone, you just can't. So that's my question.
I can take that. Yes, this is a new unemployment insurance program that is also available to individuals who are self-employed, part-time, folks who work in the gig economy. This is an unemployment program that's available to them. It's going to be administered through the state, is my understanding. And we have been hearing from folks throughout the district about some of the wait times right now at the phone number for unemployment insurance, and as well as on the website. I know, because I just got an alert this afternoon, that the state is right now hiring more folks for their unemployment office to try and help accommodate the number of requests that they are getting. It's been unprecedented in terms of the claims that are being filed right now. So I'd encourage you to continue to stick with trying to get them on the phone or get through to the website, because they are trying to get more staff on board right now to help folks and to accommodate everybody. But yes, it will apply to individuals who are self-employed, and that is part of the coronavirus third package, which has passed the Senate, scheduled to pass the House tomorrow.
All right, great. Go for another question. We've got Gauri from Oneida.
Yes, hi. My question was about the April 15th taxes. I'm referring specifically to the local taxes, school taxes, and property taxes that are due April 15th. I know federal tax filing has been postponed, but what about the local taxes? I wasn't clear whether those have to be paid by the 15th still.
Well, it's Anthony again here, and thank you for the question. I can speak to the federal taxes, and you're right. The deadline and the payment is extended to July 15th. I know that state taxes are also delayed to the same timetable as the federal taxes. In terms of your local taxes, I'd encourage you, because I don't have an answer to that, I encourage you just to reach out to either your county, your city or town, your village, whoever it is, whatever the taxing jurisdiction is, reach out to them, because I am not positive on those specific timelines.
All right, great. Let's get to another one. We've got Gary from, looks like, the Southern Tier area. Gary, can you hear us?
Yes.
You've got a question?
Yes. I worked for a local church here in Endicott, New York, and I've been off of work for about 3 weeks now and have not been able to get any kind of money to pay on any of the bills that we are falling behind on. How soon will this money or the stimulus thing be coming down the pipe so that I can tell my creditors or debtors that I have money coming and can give them some money?
Well, thank you for that question too. What we have been told, and I'm not sure if SBA has other information, but what I've been told is that in terms of that direct assistance, the direct cash assistance, as soon as the bill is passed and signed into law, which again should be tomorrow, the president has directed the Treasury Department to get those checks out as quickly as possible. Hopefully within the next 3 weeks is what they have said. I would caution that the last time the federal government did something like this, it did take a few weeks longer than that. So I can't give you an exact timeline, but I can tell you what the president has directed the Treasury, and what the Treasury has said is that they're going to do their very best to get those checks out within the next 3 weeks. I'm not sure if anyone else is hearing any difference.
Just a reminder to our panelists, you have to unmute your phone if you want to talk.
So this is Mary, and let me just jump in with a couple of things. And first of all, I heard from National Grid yesterday, and they have a customer services representative. So if you are a National Grid or a consumer advocate, I think is the correct title. So if you are having challenges, if you're a National Grid customer and you're having challenges paying your utility bill, you should reach out to that consumer advocate and let them know that. New York State Electric and Gas similarly has a consumer advocate, and that's information typically that 211 would have in their resource databases. I believe that within the state of New York, the governor has issued executive orders with respect to a moratorium on evictions and foreclosures for, I believe, up to 3 months. So it doesn't help you pay your bills, but it should give you some relief that you're not going to be out on the street. And hopefully within 3 months, more of us will be back to work.
That's correct. It was on March 19th, Governor Cuomo signed an executive order allowing for 90-day mortgage relief for New York homeowners due to the COVID-19 pandemic, which includes waiving mortgage payments for financial hardships, postponing foreclosures, grace periods for loan modifications, no late or online payment fees, and no negative reporting to credit bureaus. For renters, the governor has instituted a 90-day moratorium on evictions during the COVID-19 response, and also the New York State Department of Public Service has directed the state's major electric, gas, and water utilities to stop service shutoffs to households during the COVID-19 outbreak. If there are other creditors out there that you have questions about and you need help, please call my office.
All right, great. Let's go to, thank you, everyone. Let's go to another question. We've got Frances from the Southern Tier. Frances?
Hello, I'm Frances from Binghamton, New York. Thank you very much for providing this forum. My concern is that I have I'm from a large family. I'm 64 years old, and I have a large number of healthcare professionals working in our community. Some do home care visits, physical therapy, occupational therapy. I have a niece who's a nurse practitioner who's functioning as a pediatrician in a doctor's office, and none of them, they're all being mandated to continue their work, despite the fact that some of them are not providing life necessary services, occupational therapy and physical therapy home visits, and none of them have N95 masks. They are not provided with any personal protective equipment for their work. Very concerning, and I'm wondering, I do get newsletters all the time from New York Times, Wall Street Journal, Boston Globe, the big national newspapers, and I keep reading about the millions of masks that are being donated by Apple, a billionaire in China, someone in New York generously donating masks, and where are they all going? None of them seem to be ending up in Binghamton. That's my question.
This is Tim Endy. If I could answer the public health concerns that you expressed, and they are actually very good ones. If I just review the transmission dynamics of COVID-19, it's people who are sick, ill with fever, cough, a flu-like illness. There are some subclinical people who can shed virus. The spread is through droplets. That then, you contaminate your hands, and then you touch your face, and you basically introduce it into your mucous membranes and nose. And the current advice is for healthcare providers to monitor themselves and to be aware if they develop any type of respiratory symptoms to report that to their supervisors and take appropriate actions, which can include self-quarantining and testing. You're absolutely correct. There is a severe shortage of masks and personal protective equipment. The status, at least in Syracuse and upstate, is that they are stockpiled and have enough to meet the immediate needs. But certainly, if there's an increase in number of cases that are hospitalized, that could lead to a shortage. I can't really address the concerns about supply chains to Binghamton per se, but I just know that there's a lot of people that's putting a great deal of effort to make sure that the supply chains stay intact and that hospitals and healthcare providers have what they need.
And this is Anthony. I can add on to that a little bit more. This is something that we've been hearing about throughout upstate New York, and unfortunately, it's a situation that's happening across the country right now. A few things. One, in the third coronavirus package that I had mentioned earlier that Congress is passing, there is an additional $16 billion for the National Strategic Stockpile to help purchase that type of equipment. I have spoken to and have called on the Department of Health and Human Services as well as FEMA to provide more masks and ventilators to our region. We need them more across all of New York State right now. We've also reported the need to the State Department of Health, and it's the state really that determines where they are distributed. So we're making it known to them that the Southern Tier and Central New York and the Mohawk Valley are areas that are in need of more of these masks. I would say long term, this is an issue we have to address better as a country. What I've learned through this process is that much of this equipment, a lot of the personal protective equipment, a lot of the pharmaceuticals, and a lot of the masks are made overseas, and a lot of that is made in China. I am a member of the Armed Services Committee in the House of Representatives, and we know and have briefings all the time about how China is the #1 national security threat to our nation right now. So God forbid we ever went to war with China, they could literally shut down supply chains in all different areas of our economy and could cripple us. And we're seeing some of that now with this national crisis and the pandemic. We need to make sure that we are producing this stuff here in this country, so when there is a national emergency or if we are in war, that we have a strategic stockpile of it and don't have to be so reliant on other countries to procure this stuff. So that's something I'm working on right now with other members of Congress, because we can't allow this to happen again.
All right, thanks so much. Let's take another question. We've got Thomas from Canastota. Thomas,
yes. Yes, I can. I own a small business in Canastota, bakery. I had to shut down due to the Governor Cuomo's shutdown. I've been closed for 2.5 weeks now. I was wondering, on that phase 3 stimulus, are my workers going to get their basic unemployment plus the $600 extra stimulus that Senator Schumer was talking about, like unemployment on steroids? And I was wondering to Anthony Brindisi, does he think we're going to be open on Easter Sunday? I guess that's about.
Well, thank you again for the question. Yes, they should get unemployment under that coronavirus third stimulus package. I would say there's other small business relief within the third package as well, in addition to some of the emergency loans that are already available through SBA, and maybe SBA can mention that a little bit too. But I would say in the third stimulus package, some of the good things in the Small Business Rescue Plan that I see in there, and that I know groups like the Chamber have been very supportive of, are things like a delay in payroll taxes to help businesses with cash flow, the ability to borrow 2.5 months worth of expenses that's available to small businesses, not-for-profits, independent contractors, people who are self-employed. It's really a dollar-for-dollar loan forgiveness as long as they're able to maintain existing workforce, and it's being used to help pay for expenses like rent and mortgage and utilities. So I would say, please reach out to our office. We're going to really drill down on the Small Business Rescue Plan and try and get information out to the public about what it entails, so small businesses can apply for it. Same thing with workers who are unemployed. Again, if you're having difficulty getting through to the unemployment office, reach out to us. We can try and facilitate better contact for you to get there. I know that they're being inundated right now, so they're doing their best to get out to people. But on the Easter issue, whether we're going to be open for Easter, I think that is very much a public health issue, and we have to be listening to the public health experts when it's appropriate to be able to start going back to life as normal. That's what I'm listening to right now, and I think it's important for all of us to listen to the experts and the public health folks who are battling this pandemic.
Mr. Paprocki, anything else to add with the small business angle?
You have to unmute.
I was going to say, reminder, you might need to unmute.
Oh, are you there?
Oh, maybe it's nothing. Oh, we can hear you.
I'm sorry. While I'm really not authorized to comment right now on pending legislation until we see what the details are on how to go about some of the accessing some of the benefits of the package. One of the biggest intent of hello? Can you hear me?
Sorry. Yeah.
Sorry. Is part of one of the biggest benefits and part of that package is going to be loans that are going to be made through private sector lending institutions with SBA-backed guarantees, 100% guarantees, that will be forgiven completely if the monies are used to keep employees on board, rent, utilities. I think the congressman mentioned that. But stay tuned for the details of all of this that will be coming out. Should be out mid next week, I would think, at some point, and we'll have more information about that.
All right, great. Thank you so much. And one of the tips that the State Department of Labor had suggested we share with constituents who were experiencing trouble with the website not operating as it should with as much volume was to try after hours, maybe before 7 a.m., after 7 p.m. Let's get another question. We've got Fred from Greene. Fred, can you hear us?
Yes, I can hear you. Thank you for taking my call, and thank you for holding this session. I was wondering about the hand washing. I've heard a lot about hand washing. I've also heard that the virus can live on plastic and on stainless steel for up to 3 days, and I haven't heard very many people talk about leaving the water running until you can turn it off with your paper towel. So I was wondering about that. But also, I haven't seen how long the virus can live on fabric. I haven't been able to figure that out. I noticed that a lot of people use their fabric, like if they're pushing an elevator button, etc. Just public health concern.
Yeah, this is Tim Endy. I can answer that for you. First of all, it's a new virus, and there is very limited information about the longevity of the virus in the environment. Though there has been one paper that was published in New England Journal which suggested that in porous surfaces like cardboards, the virus could live up to 7 days, 3 days on surfaces that you just mentioned. So definitely, surfaces can be contaminated by the virus, and you could potentially touch it and then get contaminated yourself, and then touch your face and mucous membranes to infect yourself. So that it is important to try to disinfect your area. And the virus is very sensitive to detergents and bleach-like products, cleaning solutions that you have at home. So disinfecting an area that you're worried about in public areas, to be careful and wash your hands, which has been shown to be very successful in eliminating the virus, are all good things to do to protect yourself.
All right, great. Thanks so much. Let's take another question. We've got Susan from Lebanon. Susan, can you hear us?
Yes, thank you. I'm hearing from the doctor that beds are plentiful at this time, but that we do not have enough personal protective equipment, and that's consistent with what I hear talking to the health professionals in my area. But I'd like to revisit the question of whether the general public should be wearing masks, not purchased masks, but masks that we make for ourselves, or scarves, or anything to cover our mouths and noses when we are in the vicinity of other people. We've been told by some medical professionals that the safest thing to do is to act as if each of us is in fact infected, because there has been transmission by people who have no symptoms. And yet we are also being told that we don't need masks unless we are ill. I think that a mask reminds you not to touch your face, which is helpful. And there have been studies indicating that homemade cloth masks can stop as much as 50 to 60% of virus-sized particles, which is not as good as a purchased surgical mask or an N95 mask, but it is way better than nothing. So I challenge our medical guidance here. It seems to me that people of my age, I'm 67, should be, in fact, covering our noses and mouths with a scarf or a bandana or a homemade mask when we are out in public, for our own sake and the sake of the people that we meet in public. Please comment.
Yeah, this is Tim Endy. Thank you. That's a great question. My dad asked me that the other day as well. He's 82. So there's the public health message, and then there's the personal message. You know, the public health messages are recommendations that apply to the entire population, which includes social distancing, staying at home, staying 6 feet away from others, going to grocery stores and others, during off hours to reduce your contact. Those are all recommendations that will eliminate person-to-person transmission. Certainly, masks, by the CDC has been recommended to reduce the ability of transmission through droplets. And you're absolutely right. Wearing a mask does change your behavior. Certainly reduces your ability to touch your face. Masks can be potentially what we call fomites as well, where if they become contaminated, they could then contaminate your hands and then your mucous membrane, so that masks should be carefully disinfected or washed, or if you use that. So on a personal basis, I think you should do what's comfortable for you that makes you feel safe in the public, so that you're able to go out. If that means wearing a mask, then I think that's what you should do. And I don't think anyone would deny you from doing that. I hope that answers the question.
I think so. Thank you so much. Let's take Caitlin from Cortland. Caitlin, can you hear us?
Yes, I can.
Do you have a question?
Yes. So my question was regarding being a student. I'm 36 years old. I have an autoimmune illness. And I know that we are actually switching to online classes, but one of my classes is a lab, and it's going to require us to be in the school. Right now, I'm living in a building with elderly and people with autoimmune illnesses. And aside from that fact, I'm just wondering, because we've got students that are coming back from spring break, we don't know if they're contagious or not, if there's going to be more done to possibly stop the spread of the virus, if the schools are going to shut down completely and not allow us to, go back for class like that.
This is Tim Endy. Maybe I can address some of those concerns. May I ask what school you're going to?
Oh, I'm sorry. I think after they ask the question, then they're not able to back and forth with us.
Oh, okay. Sorry about that.
No worries.
Thank you for your question. And you are one of those vulnerable populations, that are vulnerable in the sense of being immunosuppressed, have an autoimmune disease, perhaps being on medications that suppress your immune system, so that you need to be extra careful about that. I know here at Upstate and the other schools in Syracuse, including SU, all students have been sent home, and all the learning is being done online through Zoom lessons, and so that education can continue. If the school has asked you to come back and congregate with students at this time in a laboratory environment, they need to have protective measures for you in place to do that, or to get you the education that you need virtually to be able to satisfy those requirements. I'm not aware of any schools that are actually doing that. I think most laboratory-based programs are going all virtually online, and doing the laboratory-based experience later on once we're finished with the epidemic.
Great. Thanks so much. Let's take another question. We've got William from Cazenovia. William, can you hear us?
Yes.
You've got a question?
Yeah, my question is for the congressman. I'm just wondering how the stimulus payment is going to be treated. I know in 2009, that stimulus was treated as an advance on income taxes. Is this going to be taxed, non-taxable income? Is it going to be an advance on the taxes paid for next year, or how are we going to handle this?
Yeah, thank you, William, for the question. I since this is refundable tax credits, it's not taxed. I will say this. My understanding is, and I'm spending the day today reading through the bill, but my understanding is that they are looking at 2018, 2019, if you filed already, adjusted gross income to determine whether or not you're eligible. The only time you would get taxed, because this is really based off of what you're earning in 2020, but of course no one's filing for 2020 yet. So the only time that there would be some kind of additional tax is if your income, if you went above the income eligibility in 2020. If it's different from your 2019 or 2018, the last time you filed taxes. So my understanding is it's not taxable. However, if in 2020 you're going to see a bump in income that would take you over the $75,000 for individual or $150,000 for married filing jointly, then you may be subject to some income tax. That's my understanding.
All right, thanks so much. Let's take another caller. We've got Carrie in Shenango.
Hi, thank you so much. Thank you, Congressman Brindisi, and everybody who's spending all the time to give us the information. We really appreciate it. I am really happy to see the third stimulus act go through and what's going to be so helpful for our businesses. Some questions I'm getting from some of my constituents here is the 501c3s and 501c6s, which Commerce Shenango falls into that category, who are losing revenue based on festivals and events and programming, membership drives that they can't do. It's lost income that they're not going to be able to recoup this season. Is there anything in the stimulus package that can help with some of that?
Can you hear me?
This is the SBA. I'm not sure about what's for not-for-profits. I know that they are eligible for our economic injury disaster loans. So like I said, I haven't seen the complete bill and the language yet, so I can't really comment. It's something that we could probably answer later next week about that eligibility through the stimulus package. Maybe the congressman has more information than I do about that.
Yep, the $350 billion in loan forgiveness grants to small businesses also does apply to nonprofits. So that the answer is yes, and we can certainly get more information out to anyone that's interested. Once the bill is passed, signed into law tomorrow, we should be having some more information out there next week, and we'll be happy to provide that to everybody.
All right, great. So we're actually a little over time, but I think we'll take one last question if everyone's up for it. We've got Helga from Oneida.
Hello.
Helga, can you hear us?
Yes, I can.
You've got a question?
Yes, I have. I would like to know how we're supposed to contain this horrible virus by bringing in people from New York City, that's a melting pot of this virus, and bringing them in our communities to infect more of our people. They did it with a busload of prisoners, from what I understand, in upstate a couple of days ago, and they found out one of them was infected. So that means everybody on the bus, the driver, all the guards and everything have got to be tested, right? And how can
Hello?
I think we've lost her. Yep, I think the question's FaceTimed out.
I think Dr. Endy addressed this a little bit earlier, and my understanding right now is that the city of New York, they are working very hard to increase hospital capacity down there. As I mentioned, the Army Corps of Engineers is working diligently to try and address any overflow by looking at sites like in the city, like the Jacob Javits Convention Center, to try and address overflow to prevent folks from having to go to other parts of the state. Obviously, if you can keep people close to home and treated closer to home, that would be ideal. And hopefully there's not a need for folks to come to other parts of the state. But I know all the health systems are preparing just in the event something like that may happen, but also to be able to accommodate folks here in the event they're in need of hospitalization.
And we probably don't know the specifics about any residents of any docs facilities. Yeah, that's right. Unfortunately.
I don't know about that, but we can certainly, if you want to just reach out to our office, we can certainly try and find out more details about that.
Which raises a good point. If anyone needs to contact our office, the phone number is 315-732-0713. And I know we had a lot of questions. If you weren't able to ask yours during the town hall, just stay on the line and leave a message, and we will definitely follow up. Anthony, did you want to give us any closing remarks?
Sure. Thank you, Sarah. And I just want to thank Jack from the Rural Health Network of South Central New York, as well as Dr. Endy from SUNY Upstate, and Mr. Paprocki from the Small Business Administration, as well as Mary Shaheen from 211 for being a resource for us. And I know that they are there in our community and can be a resource going forward. And I want to thank everyone on the line for joining us today. We had some very thoughtful questions and some very important questions. We had a very high volume of calls, so unfortunately we were not able to get to everyone. But if you stay on the line, you can leave a message with my office and we will get back to you. So if you have questions or you need assistance, please call my office at, if you have a pen handy, the phone number is area code 315-732-0713. We are here to help you. I'll just say that we've been getting a large number of calls the last couple weeks, so we're working very hard to try and get back to people within 24 to 48 hours to answer your questions. But if you leave the message, make sure you leave your contact information, your name, your phone number, a brief summary of your question, and we will get back to you. We're all going to get through this. I will say that for me, the key right now is saving lives, helping to end the public health crisis that we're going through, and then secondly, supporting our families, our workers, and our small businesses. And I think the best way Congress can do that is the best thing Congress can do to help our economy is to support the everyday workers out there who make our economy work. So we're in this together. This is probably the closest we've come to World War II, where we all had to get together and all hands on deck. But I know we're going to get through this. We're going to do it together, and our country is going to emerge much stronger. So I want to thank all of you for what you're doing in your communities, And please know that my office is here as a resource for you. We stand ready, willing, and able to assist you and answer any of your questions. Thank you to all of our experts for taking time to join us today and provide resources. Your work is so important, and we want to make sure that you continue to be able to do your work safely. So thank you very much, and that concludes my comments. Thank you, Sarah.